Hello, my name is Linda Tominick, and today I am presenting my case an argument against anti-maskers. We have all seen the no shirt, no shoes, no service signs in establishments. Never would I have imagined that these signs now include masks. Our new reality is mandatory masks. As of December 10th, 2020, 38 states have mandates for masks. State mandates vary in details, for example, exemptions for children ranging in cutoff ages from 2 to 12 and as very well for state counties. But broadly speaking, they require masks in indoor public spaces such as restaurants and stores, on public transit, and outdoors when unable to maintain 6 feet of distance from others. A recent study led by the UCS Dornlife Center for Economic and Social Research reported that 80% of Americans believe wearing masks. But it hasn't been reported if these individuals follow their state guidelines or wear the masks properly. Adjusting to the pandemic from COVID-19 has certainly not been easy. It has affected everything from education, travel, work, human interactions, shopping, and everything else beyond that. It is pretty known that America is one of the worst countries for how many cases we've had. Out of the 69.5 million cases worldwide, America is responsible for 15.7 million of these cases as of December 9th. 2020. Not only does the U.S. have the highest reported cases, the way many citizens view the pandemic as not a big deal is quite pathetic. From the very start, U.S. President Donald Trump has proven not to be taking the pandemic seriously. He has promoted hydrochloroquine as a cure for the virus, despite research showing that it is likely to be ineffective from the FDA and quite toxic and fatal, to which a couple in Arizona believed to be quite true, and the man passed away after consuming these toxic chemicals in March 2020, according to CBS News. Along with this, his initial refusal to wear a mask has undermined the seriousness of the pandemic. Many citizens take any information he spews to heart and fight the mask mandate. My argument today is to prove how masks offer initial prevention amongst the spread of COVID-19. Although there are many types of masks offered, the most effective is the N95, which is very difficult to obtain from the worldwide shortage. The most common is the cloth mask. COVID-19 is transmitted predominantly by respiratory droplets generated when people cough, sneeze, sing, talk, or breathe. According to the CDC, multi-layer cloth masks block release of exhaled respiratory particles into the environment, along with the microorganisms these particles carry. Cloth masks are not only effectively blocking most large droplets, but they can also block the exhalation of fine droplets and particles, which increase in number with the volume of speech. Multi-layer cloth masks can block up to 50 to 70% of these fine droplets and particles and limit the forward of those not captured. Upwards of 80% blockage has been achieved in human experience that have been measured. Living in America, it is common to run into anti-maskers, whom are individuals who refuse to follow state mandates and wear masks, putting not only themselves at risk, but others by spreading the virus. They often claim that they can't breathe, it's uncomfortable, and it's unnecessary. These claims have been debunked by many medical experts and have been proven it is still manageable to breathe unless faced with a severe medical condition that affects breathing, in which they are dismissed from the mask's mandate with approval from the doctor. In a survey conducted by the National Study of COVID-19, in August, 40% of the individuals had said it violated their rights as American citizens. 24% were uncomfortable, and a combined 64% Americans believe that it was their right to have to be inconvenienced by wearing a mask or a scarf over their face, because it is more important to be inconvenienced by wearing a mask or scarf over their face is more important than reducing the probability of getting sick or infecting others. Not only do these people refuse to wear their masks, they have had many protests for the anti-mask movement for individuals who believe masks infringe on their bodily anatomy. Proud anti-mask activists have adopted the term sheep when referring to a person compliant with the law by wearing a mask. A reason for this refusal is denial. Denial might be at the root for many people's refusal to wear masks, and it is an extremely powerful defense mechanism. Denial kicks in automatically when someone can't handle the depth and seriousness of the situation. California-based psychiatrist and author Jayana De Silva explains the COVID-19 crisis is traumatizing, and many psychological defenses will arise to help people cope. Denial leads to avoidance and then leads to not hearing the facts, which leading into not following the safety measures to prevent the thing that they fear. It is a vicious, unhelpful cycle which ultimately contributes to the problem. It is not common to find false information in people who believe in conspiracies on COVID-19 being non-existent. They claim COVID-19 doesn't actually exist, but is a plot by the globalist elite to take away our freedoms, and it's claimed to no worse than the flu. They spread their beliefs and increasingly refuse to observe social distancing measures. They directly sorry. Where was I? They directly help to spread the epidemic further than their localities and increase the resulting death rate. Another common conspiracy is COVID death rates and cases are being inflated, and therefore there is no reason to observe lockdown regulations or other social distancing measures. Prominent in promoting this myth is Dr. Ann Buak, whose speech warning that COVID-19 death certificates are being manipulated, which has been viewed more than 250,000 times on YouTube. Although there are many different reasons for people to fight the state regulations for masks, social distancing, and other COVID-19 regulations, I disagree with the anti-maskers' arguments because masks reduce the spread of the virus by 70% just with a cloth mask, proven by the CDC. I agree it is hard to cope and adjust with the new ways of living, but it is safer to cooperate with the regulations to help end the pandemic. 29 countries are already back to their normal state with either to be on track to be COVID-free and little to no cases. One example being Australia. Australia's success rate compared to other countries with high COVID cases come down to their politicians who listened and took action to health experts' advice. The speed of their responses and their citizens' willingness to listen to expert advice, according to the Professor Jodie McVernon, an epidemiologist the highly regarded Petley Doherty Institute in Melbourne. The same advice was coming from experts in the US and UK, but they took less definitive early action. He as well states the U.S. is totally out of control now, so they might be able to do things to suppress it, but it is also about turning around a population who will actively revolt the idea of wearing masks or doing anything of these things that might limit its speed, she said. He also points out that Australians are very compliant overall, and we have a level of social cohesion when things can work, which is a mark towards Americans who refuse to the simplest of precautions of wearing a mask for their own and others' protection. Although we have other countries for examples, and actually has been proven compliance of mask regulations work to drop COVID cases and rid COVID, the U.S. still refuses to take COVID-19 with all seriousness with citizens who claim themselves as anti-maskers. Although it is difficult changing the mind of these individuals who refuse to wear masks, it is important for them to understand and complicate the risks and complications that comes from contracting COVID-19. Long-term effects include damaging the lungs, heart rate, and brain, which increase the risks of long-term health problems. Underlying health conditions as well affect how one is affected by the virus. With this in mind, it is a choice one makes for theirs and others' safety to wear a mask. Therefore, it is important to educate and provide outreach efforts that hopefully affect the compliance with the mask usage. Those who report wearing masks and comply must understand it is a challenging to persuade Americans population who feel that it is their right to refuse to wear a mask. If we ensure that all Americans have access to masks and we continue to stress the benefits, research, and reasons of wearing a mask, we might just break a point in their minds to understand why we take these precautions. Thank you.